Urinary incontinence is a significant health problem worldwide that can have a negative impact on quality of life. Studies conducted on urinary incontinence show that the condition is 2 to 3 times more common in women. Women suffering from urinary incontinence may use a combination of products to manage their condition, such as diapers or disposable briefs, Foley catheters, absorbent pads. When current methods are used to manage urinary incontinence, individuals may experience UTIs or CAUTIs, skin irritation or breakdown, dehydration, or injury due to falls. The PureWick system is an innovative solution for women suffering from incontinence. The system is comprised of 2 devices: the PureWick female external catheter, which captures urine that is drawn away from the PureWick Urine Collection System. Device setup. Carefully remove and inspect all contents from the package, which will include PureWick Urine Collection System base with or without battery, AC power cord, user guide, 2,000 milliliter collection canister with lid, collector tubing with elbow connector, pump tubing, 2 privacy covers. Place the PureWick Urine Collection System next to the bed or chair where it will be used. It should be placed on a stable and even surface and close enough for the collector tubing with elbow connector to reach the user. For optimal results, place the PureWick Urine Collection System on the floor. The PureWick Urine Collection System should be stationary while in use. Device is not designed to be used while in transport. Caution: avoid creating a tripping hazard with the collector tubing or power cord. Plug the PureWick Urine Collection System power cord into the device outlet and then into an AC power outlet. The device should be positioned for easy access to the AC inlet and power cord. Make sure the power switch is turned off before connecting the power cord. Place the collection canister in the PureWick Urine Collection System base and press down firmly on the lid, making sure lid is sealed. If using the privacy cover, slip the privacy cover onto the canister prior to placing canister into the base. Attach the pump tubing to the PureWick Urine Collection System connector port and the connector port on the collection canister lid. Attach the elbow connector to the collector tubing. Attach the collector tubing to the connector port on the collection canister lid with the end that has the elbow connector. Caution: it is important that the port connections be connected correctly and securely for proper operation of the PureWick Urine Collection System. Turn on the PureWick Urine Collection System by pressing the on-off switch. The PureWick Urine Collection System is working when the switch lights up green and the device makes a soft humming sound. The system is now ready for use. PureWick Female External Catheter Placement and Removal. The PureWick Female External Catheter may be positioned while individual is laying on their back or their side. Wash hands thoroughly before placing the device. Remove the PureWick Female External Catheter from its package. Securely connect the PureWick Female External Catheter to the other end of the collector tubing. Perform perineal care by cleaning the vaginal area and the area between the vaginal opening and the buttocks. Assess skin integrity. Check for damaged skin or skin open to injury. Separate legs, gluteus muscles, and labia. Gently tuck soft gauze side between separated gluteus and labia. The PureWick Female External Catheter should fit snugly against the body. Ensure that the top of the gauze is aligned with the pubic bone. Slowly place legs back together. Warning: never insert the PureWick Female External Catheter into the vagina, anal canal, or other body cavities. To remove the PureWick Female External Catheter, keep the PureWick Urine Collection System on. Fully separate the legs, gluteus, and labia. Gently pull the PureWick Female External Catheter directly outward. To avoid potential skin injury, Never push or pull the PureWick female external catheter against the skin during placement or removal. Discard and replace the PureWick female external catheter at least once every 8 to 12 hours, or when soiled. Replace immediately if soiled with blood or feces. Users who experience irritation should discontinue use. When the canister is ready to be emptied, remove the PureWick female external catheter according to the instructions and throw away. Although the canister can hold up to 2,000 milliliters, to prevent overflow, empty urine from the collection canister before volume reaches 1,800 milliliters. Keep the PureWick Urine Collection System on to make sure all urine has been drawn out of the collector tubing and into the collection canister before removing the PureWick female external catheter. Turn the device off by pressing the on-off switch. Disconnect the AC power cord from the power outlet and from the device. Disconnect collector tubing and pump tubing from the canister. Lift collection canister from the PureWick Urine Collection System. Do not lift canister by the lid. Take the canister into a bathroom for disposal. Carefully remove the lid and dispose of urine into the toilet. If using a privacy cover and it gets wet, remove and discard.